Conspiracies Against Wellness with your host, Janelle Elgaway.
Good evening. Welcome to Conspiracies Against Wellness. I'm your host, Janelle Elgaway. If you have a question or would like to share anything, please call in at 415-915-2291. You can also chat with us on YouTube Live, on CAWNATION's channel on YouTube, Conspiracies Against Wellness live stream. Tonight, Beth will join us to share about her family's experiences concerning chronic pancreatitis disease and the struggles that they have had within the medical community. Well, Beth, welcome to CAWNATION. How are you this evening?
I'm doing great, thank you.
Great. So, can you please, I know when we spoke recently, you shared your story or the experiences with your husband, son, and daughter, and that they all have pancreatitis or chronic pancreatitis disease. Can you first tell me how old everybody is within your family?
My husband passed away 6 years ago. He was 51 when he passed.
So sorry.
My daughter is 19, and my son right now is 16.
I'm so sorry for your loss. Can you please tell me about a little bit about their health issues and what they are exactly?
As you said, they all had pancreatitis, and the pancreatitis actually went into chronic pancreatitis. You have acute or chronic. Acute is when you have flares, and then chronic is when basically you're hurting all the time. Pancreatitis is quite rare. And then if you have hereditary pancreatitis, like my kids did, they have a gene, PRSS1, which causes issues with the pancreas. And basically the pancreas breaks down our nutrients, and it also is a mechanism that steadies our blood sugar. So if your pancreas is not working, you're not getting nutrition, you also will have issues with the blood sugar. And basically the pancreas was eating away at itself, and it's one of the most painful diseases that you can have. And with their diagnosis of PRSS1, again, you can have many causes of pancreatitis, but my family was struck by the PRSS1 gene, hereditary gene. My family had a higher rate of pancreas cancer, which my husband did die from. Well, he didn't die from that necessarily. There was complications, but my children started showing symptoms. My daughter at 1 and my son at 2.
Okay.
It's a very painful disease.
Yeah. What are the physical symptoms? What did they complain of?
My husband and son, or my husband and my daughter, had severe stomach pain. It was horrible pain. Also nausea. They would throw up a lot. Also issues with absorption, which I don't want to get, but your digestion and what you're eating doesn't digest. So like my daughter was very, very thin. She was malnourished. My husband was malnourished. The pain is horrible. You really can't keep things down and eat. Usually when my daughter would get episodes when she was in the acute stage, we tried to keep her at home, little sips of water, but if the pain got too bad, we would bring her into the hospital because she would get dehydrated, which would flare up the illness, and the pain was like extremely bad, and we put her on an IV and get her pain meds until the flare passed. But then the disease progressed and she became chronic, which means she was in pain all the time. She was nauseous all the time. She wasn't getting nutrients, and so she was very malnourished. And the pain is just a very misunderstood disease. And so you really had to find doctors that understood that disease, because there's a lot of misconceptions about the disease. For example, sometimes you can tell if a person has pancreatitis because of amylase and lipase, which rise. However, in chronic pancreatitis, it doesn't. So sometimes we have doctors that are not knowledgeable about it, and people are having lots and lots of pain. They're nauseated, sick, but the doctors will do the lipase and amylase and say, well, no, because they're not raised. Well, in chronic pancreatitis, sometimes it's not. So it's misunderstood, and unless you have a doctor that understands it, you're often treated not quite good in the medical field, especially if you seek out ER.
Okay. What are some of the misconceptions of pancreatitis or chronic pancreatitis?
I think what we have seen is just drug seeking. Again, when my children were younger, it was easier because I had a great pediatrician, and you don't have that misconception, or doctors don't immediately think that with kids. However, I did have the genetic testing paper, and I would always carry it around because people would question me and say, well, your kids can't have pancreatitis. In fact, initially, we had gone down to a gastroenterologist or a GI doctor because my daughter did have issues. Her amylase and lipase were initially raised. And so we drove 3-4 hours to get to this GI doctor. My husband and I went in, and we sat down with our pretty little 1-year-old daughter, and he looked at us and he said, well, her episode, because she had an acute episode around age 1, it'll never happen again. So go home, don't worry about it. He was so wrong. She progressed, and her pain episodes and pancreatitis flares were regular. We were in the hospital a lot. And so, again, a lot of doctors don't understand this disease. They also think pancreatitis is related to alcoholism. And so if someone comes in and presents, the doctor, the ER doctor, will question you if you've been drinking, because pancreatitis, they see, is related to alcoholism, which is not. Pancreatitis has very many causes.
Right. You mentioned it's hard to find a doctor. Did you guys have a hard time finding a doctor for everyone?
Initially, we had a great doctor. We had a wonderful pediatrician, and it was just really amazing. When my husband got sick, it was very difficult. His sister actually had just been diagnosed, but I remember our struggle with him getting diagnosed. And I remember in our community when we had gone to a GI doctor here, and he was having all these issues, and I had brought up pancreatitis, and they kind of laughed and said, no, that's not an issue. And I remember being called back. They took him in for a scope because they wanted to see what was going on. They didn't believe it was pancreatitis, even though his sister had recently been diagnosed. And I remember them calling back after the scope, and I was there, his mother was there, and his sister was there, and they basically looked at me and said, it's pancreas cancer. You need to go to a specialist in a larger hospital, but, it's not good news. And again, I brought up, can it be pancreatitis? And they kind of shook their heads, and I can't believe it because they walked out of the room. The door was opened. They're just down the hall a little bit, and they started almost making a joke that I had brought up pancreatitis, and that basically, I wasn't the doctor. We did go down, or we went to another hospital, and sure enough, it was pancreatitis. Sadly, it did 10 years later turn into pancreas cancer, but again, many people don't understand pancreatitis. They think that you are drug seeking because one of the primary symptoms is pain. It's horrendous. It's horrible pain. My daughter and my son oftentimes will sweat because the pain's so bad, and they'll get in positions that they want to stay in because it doesn't hurt. Right. It's very hard to watch your child and your husband go through something like that and then be dismissed by doctors that, they're faking, or it's psychological, or they're drug seeking.
Right. So there's different types of pancreatitis disease, and is that correct? And the type that they have is genetic, right? Or is
Yes,
oh,
it's genetic.
Okay. Is this so? When it onsets, do you know? Is there a reason why there's an onset of this? Like, so you said that I believe it was your daughter. She started having symptoms at age 1. Was there something that brought that on that you know of, or it just?
You know, I've talked to many people, and I'm not necessarily sure. I know in my family or my husband's family, it seems that females have it more. But I also have a nephew who has never been in the hospital. He has episodes of acute pancreatitis. It hasn't gone to chronic, and he hasn't been hospitalized. So I still don't know the rhyme or reason in regards to the symptoms or the onset. I know, I shouldn't say, I think my daughter's episode was when she was 2 weeks old. No one believes me, but for 24 hours she would, scream in pain. I couldn't feed her anything. She'd spit it out. But I definitely saw that behavior when she was having flares. So I think her first episode was truly 2 weeks old, but it wasn't diagnosed until 1. And again, the only reason it was diagnosed at 1 is we had a wonderful pediatrician at that time who knew about my husband's story. One night she was struggling, having like stomach pains, just miserable and crying, and she would scream out.
Now, this is your daughter at 1 years old, correct?
When she was at 1, yeah.
Okay, all right.
And my husband was out that night. I'm sorry if I'm not tracking. My husband was out that night, and I would call and say she's not doing well, and he'd get back and she seemed fine, and then he'd go back, and then I'd call him and say, you got to come because she's having these episodes. We finally went into the ER, and they said, oh, you just put her on an antibiotic. Look at, she's running around. She was fine then. Just take her off the antibiotic. So we went home, and she had a few more episodes where she was crying and screaming in pain, but she seemed okay the next day. My husband said, oh, please, let's call our doctor, her pediatrician, and just let him know what happened. The first question he asked me, he said, well, did you tell them that your husband has hereditary pancreatitis? And I said, no, I didn't. I kind of said, we already had this horrible thing happen to us. My daughter can't have this. And then he said, well, did they draw blood? And I said, yes. He goes, can I use this blood to run a test? And sure enough, her amylase and lipase at that time were off the chart. I mean, she was one very sick little girl. And the only way that it was, identified is because this doctor was on top of his game.
Right.
So we were...
Go ahead. I apologize.
Go ahead.
Oh, well, I wanted to do is maybe if we can break this up a little bit, because I mean,
okay.
You have 3 members very close within your family that this is all going on with, and I think it's important to be able to, talk about, not only. I mean, I can't even imagine with one person in a family dealing with stuff. All 3, that just has to be really hard. If you don't mind, if we can start off with your husband, and again, I'm so sorry for the death of your husband. If you don't mind, how did he pass? Did he pass because of pancreatitis disease, or?
He was struggling. He became sick probably a year and a half after we married. Now, he was never identified as having pancreatitis when he was young. Teachers basically just said that he was faking. He would have severe stomach pains. But about a year after we got married, he became very jaundiced, was having a lot of stomach pain, throwing up. And so we went to a number of doctors, and I finally found a specialist because I suspected it was pancreatitis because his sister had been diagnosed. And so he was officially diagnosed as having pancreatitis. And for 10 years, he was okay. We had to have a scope done and clean some sludge out from his GI system, but then he was doing pretty good with it. And then he started having issues again, and we went in, and it showed that he had pancreas cancer. Now, people that have the PRSS1 gene have a high likelihood of cancer. So pancreatic cancer does not have a good outcome at all.
Right.
Stats have not changed in the last 40 years. So he was getting chemo, and he actually was doing really good. And this is so very difficult because he was doing the chemo, the radiation, and there was no signs of the pancreas cancer, but he was having difficulties. And again, it didn't seem like anyone was listening, that he was having these difficulties, and I kept calling his doctors and saying there's issues. He was having fevers, he was getting chills, more nausea and more pain, but indicators came back it wasn't cancer. So I said, something's going on. In fact, it was so hard because, they were dismissing him, and so then he was ignoring stuff.
Okay.
And saying, I don't need to go in, they can't find anything. And I remember he took my daughter into the doctor one day. He just got sick. And he called me and said, I'm going down there, something's wrong. So he walked in his doctor's room.
Mm-hmm.
He had 105 fever.
Oh, my goodness.
They put him back in the room with my daughter, and just said, okay, we'll have the doctor come back and see you. My daughter called and said, Mommy, something's wrong with Dad. He was hallucinating because he was at 105, and they had put him back in this clinic, and no doctor had come and checked on him. So we got him to the ER, and eventually they found out there was an issue with the vena cava, which is in the GI system. We got him to another hospital. He had surgery.
Mm-hmm.
So my daughter and I went up and picked him up one day to bring him home, and he seemed to be doing worse. And he had this small cup right by his bed, and my daughter picked it up, and she came and said, Mommy, there's blood in there.
Oh.
And, this is after they had done the surgery, and so you're supposed to be seeing someone who's doing better and there's relief, but...
And this is in the hospital,
confused.
too, right?
Yeah.
Okay.
It was in the hospital after they did the surgery, and the nurse, I said to the nurse, this is blood. And she said, oh, he had grape juice. I said, or cranberry juice, something in the morning. I said, no, this is blood. Oh, no, he's just fine. I said, he is not doing fine. And even my husband at this time, who was very strong and would just say, okay, just listen to the doctors, I knew he was just defeated because he knew he was very sick. And the nurse was saying, no, it's not blood. It's just cranberry juice. And I said, I'm not leaving until I see a doctor. I'm not leaving. So the doctor came in and said, no, he's just convalescing. He's fine. This isn't blood. He'll be fine. You'll drive back home. You'll see his primary doctor tomorrow. He just needs to get stronger. I'm like, I'm really scared that he's not doing well. And it was a 8-hour drive back home. And he got more and more confused. And my poor little girl is in the car just not knowing what's going on. Basically, they had made an error and had mixed something in the surgery, and he was filling up with blood and suffocating, basically. He went into the doctor the next morning. He wasn't making sense, and I had left. I was waiting for him because we had gotten in a fight, because when you have oxygen being cut off from the brain, you're not making sense.
Right.
And he was just not doing well, so I kind of backed away, and I thought, okay, the doctor's going to catch this. He came back, and the doctor was like, oh, he's fine, he's doing fine, and I was desperate. And then finally the surgeon called, who did the surgery, because I had expressed concern and said, well, how are things going? I said, he's going to die. I don't know what's going on. Something's wrong. He just went to his primary doctor. Primary doctor said everything's fine. So she goes, okay, I'll call him. So she called him. He was in the house at this time. I had just dropped him off, and I was sitting in the driveway crying. She calls me right back and said, you need to get him to the ER right away. He doesn't even remember going to that doctor.
Wow.
And by the time I got him there, they tried to stabilize him. That night he had a heart attack. And they almost lost him. Then they got him into ICU. I thought we were doing good, and then they had to intubate him because he couldn't breathe on his own because basically he was suffocating because of the blood filling up, and he died from pneumonia without signs of pancreas cancer in his body.
Wow.
So the treatment killed him in complications.
So was it actually pneumonia? Or
what?
Was it actually pneumonia that he died from, or was it? Do you believe it was from all these complications?
It's from the complications,
right?
I mean, it's pneumonia, but no. If they had listened to my daughter and myself, and not discharged him, I think there's a chance that he would be alive. And for my daughter, at that young of age, she's the one that told the nurse and myself, there's blood, that's blood, you can't let him go home, you can't let my daddy go home. And they just dismissed us. and told us to take him home. And by the next day, he was, in ICU, fighting for his life.
Okay, wow. That's just horrible, and it's interesting because it seems like the more people I speak with, it seems like when you go to hospitals, it's almost a death sentence anymore. I mean, I'm not saying it for everywhere, but I hear so many issues from going to hospitals,
I definitely will tell people that you have to advocate for yourself. And sadly, it doesn't seem, I don't necessarily know that this is the doctors or the insurance or what's going on, but there has to be a collaboration between the patient or the parent and the doctor. And there are doctors that don't want that collaboration or don't believe you or don't dismiss you. And I think when you're talking about pain, and especially opioids, they dismiss you real fast because of our culture right now. And so if you're having pain or you're having issues, it's a very sad state.
Oh, I absolutely agree with you. Did they always do that, though? Because I'm not sure how long you were married to your husband, but, if he passed away 5-6 years ago, was it like that from the beginning with the opioids and the whole...
Well, Mitch, my husband, wasn't on opioids at the time. He did not go into chronic pancreatitis until later, when I was married to him. So when he was younger, they just kind of ignored it. He had pain, but it wasn't like when my daughter had it. She had it chronic, and then
are you there, Beth? Hello. Oh, I think we lost Beth.
Hello?
Oh, okay, there you are.
Yeah, sorry.
That's okay.
But I know right now, and when my children were younger, they've always been on opioids. But right now, with my children, it's the opioid, the war against opioids, and just what the CDC is doing, and it's very difficult, and I'm very scared for both my children.
Right.
I just think there's not a...
I guess what I'm asking is was it always like this? Like, from the beginning with when your husband first started having symptoms of pancreatitis disease, was it always a problem getting him medication? Was it always a problem getting him treatments and stuff like that? And then even with your children too, because,
Not initially. When my children were younger, we had a great pediatrician who worked collaboratively with a GI doctor, the pain doctors, and so they worked very collaboratively together, and he was very much looking at all pieces of their health, not just the GI issue or the pain issue. He would look at their mental health, he would look at the family, he would look at a number of things and try to assist, because when you have a chronic illness, it impacts a lot of things.
Yeah.
So when we had a doctor like that, it was better, but we lost him.
Right. When Dr. Fuden was on last night, he was mentioning about how the subject of specialists came up, because doctors just need to know so much anymore that they, you basically have to go to a separate doctor for everything anymore, it seems. And it's interesting what you're saying right now, that that one doctor that you had, they were just so good at everything. And it's a shame, because you wonder, how do they remember? You know what I mean? Because they have to see so many patients. And, if they are focusing on one specific thing, how are they going to know the rest of you? I mean, we are connected. It's not like our head is, not connected to our body.
And I agree, and sometimes I think you look at primaries, and it's okay if you don't have health issues per se, and you're going to a primary, and they're just looking at that one thing. Maybe that's okay, but if you have complex issues,
right?
You need a primary doctor that can work well with a specialist, but also just be comprehensive and understand that patient, and understand that person and their concerns also. We've had so many specialists who, they've had one glimpse, or a hospitalist that come in the middle and make assumptions about my daughter without hearing the whole story, or make assumptions about my son without hearing the story, or reaching out to their primary doctors. So I do think doctors have to work better together, and if there's a hospital or specialist, then reach out and work with those primary doctors.
Right.
Listen to the patient's story they've been through. They know what works. I was in a situation where my daughter indicated that she was allergic to tramadol. She would flare up. Her face would swell up. Well, she went to the hospitalist, and he jumped on it and said, well, I think she's addicted, and she's lying to me. They gave her tramadol.
Oh, man.
It was on her list not to, but he got it in his mind that she was addicted. She was looking for pain meds, and thus, tramadol was less of an issue, and thus he gave it to her.
Wow.
I mean, it's ridiculous. I mean, if you go back in her file, you can see that a reaction was listed.
Right, but they probably weren't even looking.
I can't even believe a doctor would do that, because she could have died.
Right. No, I get that. And you made up a great point, too. One thing I've learned with all of my health issues, because I have a few rare diseases, I've learned to you have to create a team with your doctors. Like, I have a point doctor, which is usually my primary care doctor. Then I have a pain management doctor. Then I have my neurosurgeon. Then I have whatever specialist I need for, whatever else. But my point doctor, which is usually the primary care, they will know everything usually, and make sure that all the doctors are talking to them. It took me years to figure that out, to do that. Have you been able to do that, or have you noticed if that worked for you and your family?
Well, and that's what, again, for my son, he's still in pediatrics.
Okay.
So we have a great doctor now who does that. But when my child, my daughter, she was 18 and moved into the adult realm, that was not done. They piecemealed her, assumptions about addiction, numerous things, and they weren't talking to each other. And so, she became more and more distraught. She felt people weren't listening to her. She wanted to give up.
Right.
And I finally found a physician just recently, in the last probably 7-8 months, who treats her comprehensively and is involved in her care and does some of that stuff. But I think insurance companies the CEOs of hospitals or clinics do not like that, because they're, utilizing time. But quite honestly, it's most effective, because if you don't have that coordination of someone who has a chronic condition or a rare condition, it's not going to work. You're going to, have people doing all sorts of things. So now finally her care is getting back on track, but it wasn't. We had to go through a couple of doctors, and they really didn't know how to do that teamwork or be that primary point and reach out to the doctors.
Yeah.
And it really damaged her relationship with doctors, and it really caused a lot of harm to her health-wise.
Right. Well, and I'm sure it also, mentally, she probably has a fear of doctors. I would be afraid if something terrible like that happened.
Well, both my kids have post-traumatic stress disorder from medical experiences, and then being disbelieved by medical doctors, personnel. I
think that's going to become more a more common thing, because I think that happens with so many people, and it's a reality anymore, sadly. Does your daughter have an advocate, or do you go to all of your daughter's appointments? Because that's another thing. I've learned it's so important to have somebody with you, because especially if you're the one that's sick, you'll forget sometimes, what was said, or maybe you didn't hear something, or sometimes you just need somebody to stand up for you, because...
Yeah. And it's a balance right now, because, she's 19 and I want her to have some of those skills.
Right.
And so I want her to do some of that on her own. But we've had so many instances where, she has PTSD and, again, she's in the hospital, and you have a hospitalist that only has a piece of it and makes some assumptions. A lot of people haven't dealt with pancreatitis. And then, again, I guess I forgot to mention this, is that they did a radical surgery on both of my kids because they had a 75% chance of pancreas cancer, and they were always in pain, to try to give them a better quality of life.
Right.
So they took out the pancreas, the spleen, half the stomach, numerous things, and so most doctors don't know how to deal with them. Well, they had many complications, and they didn't, get the trade-off of a better quality of life.
Right.
And so doctors really don't understand how to treat and what to look for. And so it's very complicated because, it's not seen a lot. And so, yes, I try to go with her, but I also try to step back because she has to gain those skills. But again, she's been shut down by a lot of doctors.
Right.
And so it's going to be a long process, I think. Right now, she's out in California, and it's a place where, she's getting that assistance in regards to going to endo and GI, but also dealing with that trauma, medical trauma that she experienced, because it does a lot of damage, I'll tell you that.
Yeah.
I mean, when you're in pain and someone says, no, it's all psychological or you're faking it, you don't trust yourself. You think, am I crazy? Doubt yourself.
All right. So you mentioned these surgeries that both your kids had, and I know that's like one of the harder surgery. Well, it's a very hard surgery. When we spoke previously, you mentioned what's really, really important if your child or if even you get this surgery. What is important that prior to getting it?
I guess different. There's only a number of places, like 5 or 6 places in the United States that does this. And I did go to a very, very, I think it's probably the number one place. Maybe I'm biased. Again, I'm frustrated with the aftercare. And so when I talk to people that are looking at the surgery that have pancreatitis and they're in a great deal of pain, I want them to be optimistic that things are going to go well. But it's a hard surgery, and I also want them to know, okay, talk to your team. What happens if there's complications and you're dealing with complications the rest of your life? Because quite honestly, what happened to us is that they said, oh, sorry, it didn't work. Figure out on your own what you're going to do, and that was a difficult time. And so I always tell people, if you're looking at this surgery, one, you can't compare yourself to others because it can be a really long healing process. I've talked to people that do wonderful in like 6 months, and other people that it's taken 3 or 4 years. And some have complications, some don't. But what I really tell people is, if you're thinking about this, you also have to say, okay, what if it doesn't go well and there's complications?
Right.
What happens then? And ask the team, what are you going to do? What supports are you going to provide? Who can I go to? That's a real gap here for our people that are looking at doing the surgery, is the aftercare.
Is there a lot of support groups or locally and online for this kind of stuff and to learn information about this?
I think what I have loved about Facebook is the proliferation of these support groups. Because this is rare, you don't find a huge amount of people that have it in your community oftentimes, and so it's hard to have a support group on a regular basis. I really have been so appreciative of those I've met online. Well, some of them I haven't met. I can tell them anything because they truly understand it. They understand the frustrations, the options, the, what you endure. And so it's been a lifeline for me. I know that. And I've also, we have gone to the one hospital, which is renowned for it. I mean, there's like 5 or 6. And so we've met many families. And so we keep in touch with those families. And again, it's been a lifeline for me. I don't know how I would do it without the Facebook support groups.
Right.
While it's on Facebook, we also do phone calls, but people are just there and they understand it.
That's great. That's really great. You mentioned your daughter recently had an issue where someone slipped a script. What does that term mean, slipped a script?
Well, she had been going in the hospital because she couldn't stabilize her blood sugars, and so it was on a regular basis, and she's also on pain meds. So, again, we live in a culture where if you go in, you have pain, they look at you and say, well, you must be an addict. Especially, she hates going to ERs or dealing with doctors because she feels like they have never listened to her. Understandably, I mean, she's been through a lot. She was hospitalized, and upon leaving, they gave her a slip for a pain med. When you get a slip filled, you have to have your ID with you.
And a slip is a prescription, right?
Yeah, a prescription.
Okay.
Yeah.
Okay.
And she got it, and she got it filled. I had to go out of town, and she had seen her primary to get another slip or a prescription because they have to write it so often, and they monitor you.
Mm-hmm.
And so I got a call from her, upset and saying they're not going to prescribe anymore because there's issues. So I had called the nurse, and they just said, well, there's issues. Well, what had happened was a doctor had written a script in her name and given it to another patient. So this patient went in, gave it to the pharmacist who should have checked it, and they filled it. And so when I called the pharmacist, they said, oh, yeah, we filled it. I said, I want to know, who came there because you shouldn't have even filled it without an ID. And it was embarrassing because they thought that Ellie, my daughter, had taken the script or somehow forged a script for pain meds,
mm-hmm.
Drove 2 hours away. Police were involved. They were going to cut her off her pain meds. And ultimately, they found that the doctor had written a script and given it to someone else.
Wow.
But it was just, she was horrified. She was embarrassed. And, they were going to cut off her meds. And again, it's just the pain and opioids. Again, I believe in really a comprehensive approach for pain.
Mm-hmm.
If you can use cognitive behavioral therapy or needling, it's different for everyone. But again, I do believe opioids are beneficial. We've tried numerous things
mm-hmm.
That are not opioid specific, and they have not helped. And my kids cannot function.
Yeah,
usually, help.
Right, and usually, especially more chronic or just diseases that are going to be long term. Yeah, usually you've gone through the whole gamut. You've tried the injections if they want you to do that. You try the working out, physical therapy. Any Eastern type of medicine, chiropractic, medications. And this is going to be the last thing that you're going to do, and try. But I think people get it confused sometimes because I think they get acute and a real chronic major illness mixed up, and I'm wondering if maybe that's some of the issue when people are talking about this, because I think also the media hasn't helped, and how they've pushed
the media
everything.
Hasn't.
Right. Yeah.
Well, you know what? We will go into ERs now, and they will say, if it's acute pain, which means it doesn't last long, it's a broken arm, they will give you pain meds. If it's a chronic condition, they'll say, no, you have to manage it on your own.
Right.
And that's the CDC guidelines, and it's horrible. Would you not give someone who has diabetes their insulin?
Right.
You would never think of that. But we are okay with making people suffer, and I don't think they understand that impact of chronic pain. It impacts your whole life. My daughter and son, they just want to be involved. They just want to go to school. For him to go 3 hours, he's exhausted. He's in pain. It's hard.
Right. Well, it seems like, for one, it's survival, and then two, quality of life. Right? Does that...
Correct.
Okay. I wanted to know, once your daughter was treated this way, how did this affect her going forward? And did the doctor's office treat her okay once all this was figured out?
I think we've had a couple of episodes with this hospital, and it was very difficult. to this doctor's credit, he was wonderful. He saw all the issues that were going on. He realized that she had PTSD and depression, that she didn't know what her life was going to be like, that she has brittle diabetes now, that she has GI issues, and pain. And he was the one that said, we have to treat this comprehensively. We have to treat the diabetes and the pain and the depression. Before, the doctors were like, we're going to ignore the pain. Well, if you ignore the pain, the depression is going to get worse.
Right.
Or, you know, things like that.
Well, and other health issues will start up too.
Well, exactly. If you ignore the depression, the diabetes control is going to be out there. So he's like, no, we have to, I mean, he got a lot of pushback from some of these doctors, but again, they ended up with egg in their face because they were wrong.
Right.
But he was the one that said, okay, we have to treat you comprehensively, or we're never going to get you to a place where you need to be. I mean, she'll always have health issues, and she'll always struggle, but she can have a better quality of life. We just have to address the pain, the GI, the diabetes, and the depression, and get those all working. But we can't do it in single, okay, we'll do the depression or we'll do the pain, because it just won't work.
Right.
So he actually has been a lifeline for us.
That's great. You know, it's so sad. I mean, but I guess it's your only option. It seems like, especially with the more rare illnesses, there's no playbook for anyone on what to do. You know, what doctors do you go to? Making sure that this is a point doctor. Can you say, no, I don't want to go to this doctor anymore, I don't like them, and go to somebody else? You know, how do you react? Do you go to the hospitals? Do you go to the ERs? Do you get these surgeries? You know, what medications should you take? What different treatments should you do? There's no playbook. So it's almost like you're walking blindly. And I don't think it's just for, you know, this disease. It's for all of them. It's really, really hard to figure this out. And I think that's why it's so important also to, you know, to share and talk with each other, and like, you know, how you have your support groups on Facebook. Have you learned a lot from them? Do you guys share a lot of, you know, what's helped, what hasn't?
Yeah, absolutely. In fact, you know, I think when I look at those people that have supported me, they oftentimes have said, you know what, bring this up to your doctor, because I think this is what's going on. And I have, or I've told other people, you know, you need to bring up this. And we have helped each other advocate for our children. And it is hard, because oftentimes in the medical field, the doctors are seen as all-knowing.
Right.
So if you say, no, this is what I'm concerned about, and you're getting dismissed, it's very difficult. And if you kind of raise a ruckus, then you're seen as that crazy lady or that crazy mom. And what I really look for in a physician and that point person is that they'll listen, you know, to me, that they understand this is difficult. It's not easy, and I am going to be an advocate for my children, and please partner with me.
Right.
And, you know, for my son right now, I have it, and I'm thankful I have the whole team that works together. And for my daughter, I think we're getting there. But again, it's just they have to work together. Physicians need to work together, and they need to listen to their patient.
Right.
And I don't think we're in a culture right now, especially when you're talking about chronic pain and rare conditions, that relationship can occur, because, especially talking about pain, because they're like, no, you're addicted, and we can't give you scripts because we'll get in trouble, because we have to cut down on pain scripts.
Right.
Well, then you're talking about my child's quality of life.
How do both your daughter and son handle all of this? I mean, because they're very young to be dealing with all of this. I mean, I think anybody would have a hard time. But
I think my daughter has gotten the worst of it, because, you know, like you said, there's no playbook. And so there's things that I look back and I say, man, I made mistakes here. And then with my son, I did things differently. My daughter has had so much so much and struggles and just the things that have happened to her. And she's such a strong girl, but she's looking at, okay, what can I do with my life?
Mm-hmm.
You know, I had plans to be a doctor. She was smart. She is smart.
Mm-hmm.
She was involved when her disease wasn't that bad, but now it's very difficult. She's trying to find how can I, where's my purpose? What's my role here? And so it's been really, really difficult. My son, we've struggled because I've sometimes listened to doctors and said, no, you got to do this. You got to push through. And he's like, I'm in pain. I'm fatigued. And you're not listening to me.
Mm-hmm.
And so it is hard because sometimes you're listening to a doctor, and so you ignore your child. I don't mean to ignore, but you feel caught between the two. And I've made some horrible mistakes because I have listened to the doctor, and not advocated.
How does the school treat your son? Is the school helpful? How do they treat?
Quite honestly, I had to
go ahead. I'm sorry.
A lawyer involved. It was horrible.
Really?
For my daughter. I think one of the things is if you're not in a wheelchair or if you don't have
invisible, diseases.
The bald head from chemo, and this was horrible, that you can have a chronic illness. Mm-hmm. And her illnesses would be one day she can do something and manage, and the next day she's struggling. And the lack of understanding there, they would say, well, you don't really look sick, or you're faking, or things like this. And it was very difficult. Her attendance level dropped. We couldn't get an individual education plan because when she was first getting sick, she was very, very bright, and she was in all the advanced classes. And they're like, oh, she's missing, but she can catch up. Well, no, there's building blocks. And so with my son, there was some difficulties when he went into high school, and I had to call a lawyer in, and we got an IEP in place, which is an individual education plan, because he can't go for 6 hours. Mm-hmm. There's no way he can. He wants to. He wants to be in school. He wants to engage with friends, but he's so fatigued and in pain, he can't do it. And then I would push, and he would push himself, and then just get mad because he couldn't do it. And so we would get in arguments, and it wasn't about him. It was his frustration that no one understood that he's trying to do his best.
Right. And
his body's just not allowing him to do what other kids can do. So, and he would cry and break down because his body wasn't doing what he wanted it to do.
Right. Well, I'm sure. I mean, I couldn't even imagine that. So overall, do you think schools are set up for children with disabilities or health issues? Or
no, I don't. I mean, maybe some situations, like if it's acute illness or you're going through treatment of something. Mm-hmm. But if it's a long-term chronic illness, no. I mean, I know kids that have Crohn's or migraines, and the stereotypical thought is just push them through it. They can deal with it. And you really have to individualize those plans sometimes. You have to, I now have his doctor involved in the school, his therapist, a nurse involved so that they understand it. And so that we can push him, but we can also understand the limits he has, because he wants to succeed more than anyone. But sometimes he gets tired, and sometimes he just, I'm too exhausted, but schools are not set up for it. And again, I think they make assumptions. You look okay, so you must not be sick.
Right. How do they have friends? Do kids do they treat your children normal, and also do the parents of the children?
I think it was different for both. My daughter was she had a great big group of friends. And, the sicker she got and depression came in when she got older, and she would struggle to go to school, and her illness would prevent her from school and activities and things that she would like to. She tried to play basketball when she was younger and was great, but the pain and the fatigue it wasn't possible. And so it's hard to engage when peers don't understand that you're trying your best. Right. you promise to go to the dance, but you're sick, and when you're not at school, you're left out. My son, when he was younger, had a great group of friends, but again, it's hard for him to go to 3 to 4 hours a day. I mean, there's times when we scheduled sleepovers, and he would get sick, and he would cry because the only thing he would want to do was hang out with his friends, but he was so sick he couldn't, and so it's sad because he doesn't have a lot of friends. He's a great kid. He's funny. He's hilarious. When I go to school, everyone says hi to him, but because of his illness, he's really not included.
Right. Are there any local or I guess online support groups for your kids to talk with other kids or with other health issues, or do you have anything like that?
My daughter was involved with other kids that have this disease, and she would talk on the phone with them, which was helpful, and she made some friends that way. My son, no. It's amazing when they went to the hospital. The thing that I love about my kids, I love many things, but their compassion is so amazing. They almost can sniff out a person who is marginalized by society or having a difficult time. In an instant, they're there. They're there to provide compassion or, a listening ear. They are very compassionate children because of the pain that they've gone through.
I'm sure. That's a great quality.
I just wish they didn't have to struggle like they do.
I bet. Are there any nonprofits, or is there anything set up nationally that would be then local for kids with either disabilities or with health issues?
I guess I belong to a support group locally of parents that have kids with complex issues, and so this was just started up, and so we tried to get our kids together to provide that support. Nationally, I know that there are organizations, but again, you have to be in a larger area for those things to occur.
Right.
So sometimes if you're in a rural community, you don't get that connection, especially if it's a rare disease.
Right. What would you like to see happen, if this was your world, and what would you like to see that is set up for your children and for parents of children, I'm sure, too, because I have to imagine it's not been easy on you.
I think one thing I'd like to see is just the medical arena change a little bit to do, like you spoke about, have doctors that can do that primary care and coordinate and be that point person. I think that's critical, and I don't think that is done. I think that's a random thing when it happens. But when I look at, when you have chronic or rare, you need a doctor like that. You need a doctor who will work with you and listen to you. I also think schools need to be prepared. One of the things that I say is that, my son needs to be involved. Okay, even if it's just one line in the play or, doing this, he needs to be involved with his peer group.
Right. Does he not want to be, or is that his choice?
He does, but it's very hard because he gets fatigued. And so you have to have, like this summer, a theater group allowed him to try out. Again, he gets sick, so he's not very stable when he can be there and that. But they gave him like 3-4 lines, and he was in the play. And I just saw him just thrive because they opened the door to him. Like he was sick one day, but someone stepped in for him. But just those 3 lines that they provided to him and let him be involved changed his world.
Oh, I bet.
But the school has not been able to do that, nor do they understand how powerful that is.
Right.
And so it's hard. It's hard to find those opportunities. But to see my son be with his peers and be involved and included was amazing, and my heart just was so full. But there's not those opportunities often when you have a kid who's you don't know how you're going to be the next day.
Right. Right.
You may be able to do something today, but not tomorrow.
Yeah, and something because I was very young too when my health issues started, and one thing I didn't notice it as much when I was younger. It took me probably until my 20s to kind of start getting it. But I realized in my 20s, you know, the more quickly I learned to cope, and realize, okay, my life's not going to be the way I thought it would be. And I think, especially when you're a child too, you're so, you know, it's your world, you know, and you don't imagine something like this is going to happen, and that you can't do the things that you want to do, and you can't go out and play, and or possibly, you know, you might not be able to go and, you know, go to college or you know, have a normal day. But do you think also that, like, if once they kind of wrap their minds around that, and accept it, and then find new things that they can start loving and liking, has either one of them done that at all, or are they kind of stubborn?
Yeah.
Because it took me a long time.
Well, I think that my daughter is struggling right now.
Yeah.
But I definitely do see her abilities. She writes beautifully. She's very articulate, and she's very caring. She's a great advocate. She, when it comes to other people who are struggling, does not care. She will stand up for them. And so I think and I pray that she will find that, what you just talked about.
Yeah.
My son, I've been able to intervene earlier. I think I struggled with my daughter knowing what to do. And so we have had that discussion. Okay, you struggle, you're always gonna have issues, but you have some really gifts here. So let's wrap our mind around what that's gonna look like. And I think we're going in the right direction. I think developmentally with kids, it can kind of fall back. So you're doing good one day and you're feeling like you're going forward,
Right.
and then you're like, I couldn't go to the party last night because I was sick, and everybody else did.
Right.
So it's 2 steps forward, 1 step back. But I do have hope that, you know,
Yeah.
if they have that good medical care, that they can get stable and do some amazing things.
Yeah.
It may not be what we perceived originally, but they have so many gifts, and they have a purpose.
Yeah. No, I agree with you. By the way, if your daughter's really great at advocating and writing, we always have opening as interns here, so she's welcome to come on in and help us out and be a part of our team. That would be cool if she was interested.
Yeah, and she would be. I think I really see her later down in life being an advocate, but even now she can write amazingly, and she's amazing.
By the way, Stacey Fields off of YouTube Live says, please tell Beth I think she is an amazing mom and warrior, and I say warrior because she fights for kids like a lion. I am proud to know her.
Oh, thank you, Stacey.
I wanted
to make me cry.
Yeah, I wanted to. We're gonna have to get going here, but I wanted to ask you before we left for the evening. How do you handle this? I mean, I couldn't imagine everything that you're going through. How do you keep it together?
I don't know if I have kept it together. There's times that I've cried. That feel like I'm lost. And you know this. I mean, we weren't given a choice to handle it or not. We just have to figure it out. I know for one, it's support groups for me. You know, on Facebook, and I've been pain groups, pancreatitis groups, and families with kids with complex issues. I also know I go to a therapist weekly. I really do. And personally, I pray. I've struggled with God and my faith, but it is there. And so that's how I've gotten through. But again, we really don't have a choice.
Right.
You're given some things, and you just have to figure it out. And it's not been an easy ride, but
you have to make the best of it. Yeah, it sounds like you have
absolutely.
You have a very great outlook on that, because you know, there's so many people that could have you know, gone the other way and given up pretty much. So and I hope I definitely will say prayers for your children, and I hope that they realize that, you know, this isn't the end. You know, I mean, they can still do anything they want. It's just different. It's not exactly the way they maybe imagined it. in the beginning. But like you said too, yeah.
Thank you, because I believe that.
Me too. Would you like to add anything before we get going?
No, I just appreciate everything you're doing, because I think that we have to really look at things differently and do things differently, and there has to be a voice given to the issues that are occurring right now in the medical field.
Yes.
So thank you.
No, you're welcome. I think it's important that, all of us have a platform to speak out and talk, and also so we're not so isolated, because, with stuff like this, you become isolated a lot, and all that will do is kind of put you in a downward spiral. So it's really wonderful meeting you, and I really appreciate you coming on and sharing everything that you have, and again, I'm so sorry for your husband's death. But it sounds like you're doing an amazing job, and just keep with it.
All right, thank you.
All right, Beth. Well, I hope you have a great night.
Okay, thank you very much.
Thank you. Next week on Conspiracies Against Wellness, Tuesday, March 13th, 7/6 Central, is the Doctor's Corner with Dr. Klein. He looks forward to answering any questions that you may have. Also at Tuesday, 8/7 Central, guest Dr. Ronald Meyer will talk about the DC rally he is sponsoring in April and advocacy work for physicians and patients within the African American and CPP communities. Then next Wednesday, March 14th, 8/7 Central, guest Anita Thompson will share the amazing advocacy work she has done for the World Sickle Cell Federation. You won't want to miss it. Well, thank you again for joining us this evening, and have a good night.
Listening to Conspiracies Against Wellness with your host, Janelle Elgaway. The opinions expressed on this program are those of the hosts and callers, and not necessarily those of EXG LLC, its employees, or sponsors. Copyright 2018 by EXG LLC. All rights reserved.